It's my pleasure to welcome our distinguished panelists, where you'll have a fireside chat really to hear about practitioners who are really doing the work. And so I'd like to introduce our moderator for our fireside chat is Dr. Ashanda St. Jean. Dr. St. Jean is a board-certified OBGYN physician with over 20 years of experience working in New York City, focused on the delivery of quality care to underrepresented minority women. She's a consultant for the New York City Department of Health. She's chair of obstetrics and gynecology at Health Alliance Hospitals of the Hudson Valley, an associate professor in the Department of OBGYN at New York Medical College, and a member of several associations, including the Ulster County Board of Health, the New York State Coalition for Doula Access, and an appointed member of both the New York State and New York City Maternal Mortality Review Boards. Welcome. Joining as a panelist is Elish J. Neely. Welcome. Ms. Neely is a Family Wellness Suite Site Coordinator at the DOH-MH East Tremont Center for Health Equity and Community Wellness. The Family Wellness Suites are within the agency's Center for Equity and Community Wellness and were created for New Yorkers of reproductive age to aid as a solution to social, emotional, financial, and health obstacles faced by communities of color. Ms. Neely currently serves as the chair of the Health Department's Prenatal Task Force, which is an advocacy collective with leading New York City clinicians and public health practitioners. Next, Naima Beckles. Welcome. Ms. Beckles is doula coordinator for the Northern Manhattan Perinatal Partnership, a vendor of the Citywide Doula Initiative. Ms. Beckles supports a team of community-based doulas who serve over 100 birthing families in Upper Manhattan and the Bronx annually. She is also a curriculum designer and trainer who has created several courses for birth professionals, including a course on understanding and responding to pregnancy loss, trauma, and infant death within Black communities, and lends her patient leadership and advocacy style to several boards, including Lamaze International. Welcome. And next is Helena Grant. Hello. Helena is a senior advisor of midwifery initiatives and co-chair of the Maternal Mortality Review Committee. Ms. Grant is a certified nurse midwife that has cared for and empowered the lives of women, birthing people and families for over 25 years, and has had thousands of new souls birthed and born, never delivered, into her hands in hospital and birthing center settings in New York City. She is president of New York Midwives, a fellow of the American College of Nurse Midwives, co-chair of the Brooklyn Borough President's Maternal Health Task Force, and the inaugural senior advisor of midwifery initiatives at the New York City Department of Health and Mental Hygiene, the first midwifery position of its kind in the country. Welcome. And last but not least, Nikisha Fool. Welcome. Nikisha is the Chief Business Officer of the Maternal Health and Hope Coalition, MHC. MHC is an alliance of community stakeholders and partners collectively working to eliminate the health disparities in maternal care and improve health outcomes for birthing people by providing access to resources that help to address the social factors of health. Ms. Ethel is a dedicated healthcare professional with over 20 years of experience in ambulatory care, hospital operations management, and substance use, and 7 years on the C-suite level in federally qualified health centers operations. Welcome. And I'll pass it to you. Thank you.
So good morning, everyone. And again, it's such an honor and a pleasure to be here with all of you today talking about what has been the passion of my career, which is maternal mortality. So first, a few things I would like to say. The bedrock of hope is protection. So how do we restore joy, rediscover joy, and return joy into the birthing experience? How can we allow so many Black women and Black birthing people to not experience joy or even erase joy from the birthing experience? Because we all know that fear is the stealer of peace. So what I want to do today is have this discussion and talk about this amazing program that's happening so that we can return joy into the birthing experience for Black women, for Black birthing people, for communities, and for families. So it is my esteemed honor and pleasure to be here with my esteemed colleagues to talk about changing the landscape of maternal mortality and really combating health inequities. So before we start, I just always like to give a quote, and this quote is from Dr. Martin Luther King. We must accept finite disappointment, but never lose infinite hope. So we'll start off with our first question for our esteemed panel. Why are there so many more preventable deaths of Black women compared to white women? What are we not doing enough of? And we'll start with you.
You'll start with me. Good morning, everyone. My name is Eilish Neely again, and in thinking about that particular question, I feel like there should be, or there could be, more alignment between those of us who are on the ground serving every day in the neighborhoods and our hospital institutions. There is an infinite abundance of data, whether it's qualitative or quantitative, and I just feel like we're not adequately applying it to solutions as of yet.
First, I love that you started with the statement about joy. And what I would add to that is, what can we learn from joy? What can we all here really explore in positive birthing experiences, especially the experiences of Black birthing people, that many are positive, many are joyful, and even when they're not, there's something that we can all take from it. So thank you for that again. I think to the question of why are there so many maternal deaths, Black maternal deaths in particular, we can't really ask that question without pointing to racism, pointing to the racist beginnings of obstetrics care in this country. We know that that's the foundation for which all of our inequities are resting upon. And we also can't ignore that we took midwives out of the equation. Like, I won't say very much there because we have an esteemed midwife there. But the reason why that speaks so closely to me and why this is so personal as a Black woman, as a Black birth giver, is because the best care of my life came from midwives. Like, I'm here because I had a joyful birth experience that was supported by midwives.
So in the reading of my bio, you all heard me say birth never delivered. It's a dirty word. I know we used it here today. I hope that that's corrected. But to speak to that and just marry the conceptualization, understanding what has been said here so far, the question was why Black women are dying. Black women are dying because medical apartheid is alive and well in New York City and New York State and in the United States of America. Black women are dying because the safety, the satisfaction, and the sacredness has been taken out of birth, and that has to do with the medical apartheid system. And so overall, the numbers and the rates and the statistics really speak to the socio-political and socio-cultural attestation of us as a community and our social apathy to the worthiness of Black women. Because if Black women were seen as worthy, they wouldn't be dying. And so in these conversations, it's a fireside chat, but it's a bigger chat, and people will go outside and have an even bigger chat. And we need to tell the truth about what is foundationalizing this movement towards the allowance of Black women and birthing people dying. Because only when we begin with acceptance of what is, that's the fact. If it wasn't okay, we wouldn't be allowing it to happen. And so that's why it's important for this model to be supported, to move forward, because that is going to bend the arc of what we are saying as a society we believe. And so that's the why, and this is one of the solutions.
So, being the last person, after all these powerful words, I think two of the things that really stand out, this maternal health collaborative, definitely why women are dying, why Black women are dying in childbirth is because no one ever recognized the importance of having a collaborative like this. A quick Google search, if you look it up, things would pop up like chronic diseases and access to health care. But really and truly, that's not what it is. It is the systemic biases and the discriminatory practices that continue to happen day in and day out. Very much of what my esteemed panelists have mentioned. It is definitely not just, if it was as easy as telling Black women, eat healthier, work out, live in a better place, get education, then that would be an easy fix. But it's not the easy fix. It's because of all these systemic biases, things that's interwoven into the culture of where we are and who we are. And that's one of the reasons why Black women are dying so much, at such a higher rate than white women.
Thank you. So I think that we already know from studies where they have adjusted for insurance type, for education, for socioeconomic status. When all of those are adjusted for, Black women and Black birthing people are still dying at a higher rate than their white counterparts. So this is something that we need to address. The saddest thing for me is when a patient seeks me out purposely, intentionally, because they are a Black person and they fear that they may die in childbirth, and that the only thing that could possibly save them is having a Black obstetrician. So this should never happen. This should never happen. And so, again, I am so proud that we are part of this collaborative, creating models that are going to be life-changing. And like Ms. Helena Grant said, bending the arc towards humanity so that patients can again return to that joy of having their children. So our next question for our panel is, can you discuss the major challenges you are seeing among pregnant women and birthing people, and how your work aims to improve and eliminate these challenges?
So I represent the Family Wellness Suite, and we are a place-based intervention. So we are literally housed in the really prominent zip codes when it comes to lack of resources and living below the poverty line. And so in addition to carrying their baby, the moms and the birthing persons that are entering our spaces are also carrying the weight of the world. They're alone financially, physically, mentally, emotionally. And so, that's something that I don't take lightly. I was working by myself. I was alone one day a few weeks ago, and I was providing crib and car seat and diapers to a mom. And the last thing I said was, but not the last thing, but I said, okay, but anything else? Like, how do you feel after getting these things? She started to cry, and I had to sit with her for 2 hours. Yeah. I didn't feel right just sending her back out. I just wanted to make sure that she was okay. We talked about what was on her mind. We pointed her in the right direction. And so something that weighs heavy on the families that we service is the actual fact that they are alone. Some of them are alone in the country. Some of them, their partners have moved on, or they might have faced betrayal from family members. So that's something that I've noticed within my own work to be super prominent.
I'm one of the coordinators for a vendor of the Citywide Doula Initiative, and I speak to just about all of our incoming clients about why they want doula support. And what is surprising, but shouldn't be surprising given the state of how healthcare is administered, is that the majority of the people I speak to want doula support because they had a prior experience that was traumatic. And so they're coming to this looking for a way to avoid the trauma that they experienced in their last birth experience. So I think perhaps an assumption could be that people are coming for doula support because they're first-time parents or first-time birth givers, but what I'm finding is that they're not. They're giving birth for second, third, fourth times, and they're saying, I don't want what happened to me that happened a few years ago to happen again, and I heard that a doula can be an advocate for me, so how can I better, how can I have a better, less traumatic birth experience?
What I've seen for the past 27 years is an over-adherence to what is known as the medical, technocratic, patriarchal model of medicine, which is a hierarchical model, which means that when you come into the hospital system, your body automatically becomes the property of those who are going to take care of you. And so here's where I do plug midwifery, because midwifery, when it's done right, and it's not always done right, just like medicine is not always done right, just like just like nursing is not always done right, but when it's done right, there is a non-adherence to that model. And so we really need to look at why other quote unquote developed, and I don't like that, I feel like that's a dirty word too, but developed nations around the world have this abundance of midwives, that midwives are first line providers in every country with the lowest maternal mortality and morbidity. But here in the United States, in New York State and New York City, there is a non-adherence to the model of midwifery and understanding its role in this crisis. And of course, that has to do with history as well, and we're not going to get into that. But when we look at collaborative models like this, there's also collaborative models that need to be taking place on medical fronts, where when a person has a medical condition, they're getting referred to that physician, that MFM, that cardiologist. But for the regular parts of their pregnancy and for their birth, they need midwifery care. They don't need to be subjected to a cascade of events, rushing them through their labor and rushing them through their birth. And that's a big thing that I've seen over the years that also would be very, would change the outcomes that we're seeing as well.
And for me, I think it is that so many times and often people think that health is created within the four walls of a clinic, but that's not where health is created. Health is created where you live, how you live, what you eat, where you sleep, and until people recognize that, and I see that the Maternal Health Collaborative, and I'm going to keep going back to it because about 2 years ago, we created a Maternal Health and Hope Coalition, which is quite similar to this Maternal Health Collaborative, which seeks to recognize the importance of everything else in someone's life, right? It's just not their diagnosis. It's just not a quick vaccination. It's just not a quick prescription. It's about living. And I go back to what the moderator was saying, that the joy of giving birth is so important. And I want to reiterate what Ms. Grant just said also, because I remember with my second experience of giving birth, going into the hospital and feeling like I don't have a say, like I'm giving up the minute I walk in here, I have no say. They're going to stress me and tell me, you got to take the epidural, hurry up, what are you waiting for? And to my surprise, when I went in, just to give a little personal story, when I went in, I knew I was in labor. And there I was saying, I am in labor, this is my second child, I know I'm in labor, I am about to give birth. And they're looking at me and saying, no, you look well, you're not about to give birth, you're not stressed out. And I'm like, how are you telling me I'm not about to give birth? And that is one story and an easy story because everything turned out well, but there's so many other stories that don't turn out well. And then also, doctor said at the beginning that people seek you out because of cultural competent care. That is for real. And the intersection of gender, okay, and race really convolutes the situation, right? Because when I was looking for a doctor, I could not find a Black woman. I found a Black man, though, and he did a really good job. But I would imagine that some men won't be able to understand exactly what women are going through because they've never given birth. So, yeah.
So I think as we look at how tragedy, how fear, how toxic events, how birthing trauma can stain someone's experience, we want to be thoughtful in terms of creative solutions for our patients, not for now, but also for the future. So again, on to our last question for our panel. What has worked and what hasn't worked in the efforts to eliminate maternal mortality amongst Black women? What is your vision for the future where Black women and birthing people not only survive, but they thrive?
I think what I'm thinking is providing folks with new realities. Some of the folks who are coming to a lot of the services in which we're involved in, some of them already know, some of them are scared to go deliver. It's supposed to be a happy, a momentous point in their life, and they're scared that they might not make it out or that their baby might not make it out. And so, I'm gonna answer it in reverse. My ambition is to increase how we do approach mental health for those who are pregnant and parenting. Again, like I said, I had to work with a mom who was going through, relational issues with the father of her child, and she just cried. And so, how often is she crying, and how far is that cry going to go? Does she feel heard? And I really do think it's time for us to really make the connections between mental health and public health, because how can we really drive home points of how to take care of yourself if folks are super stressed out, they're anxious, they are depressed, they have childhood trauma, they have been abused in all the ways. And so that's my aspiration. I'm a newly minted social worker, so in addition to my public health work, so that's something that I look forward to doing more work in, because I just think that there's more work to be done. What has not worked, I think, is our building a solid connection, again, with our clinical partners. I have been a part of meetings where we've gone into hospitals to talk about implicit bias, and the reality is some of the hospitals, they weren't very happy to see us come in, and they didn't want to hear what we had to say. They took it personal. But you can't take it personal if you're on the news because somebody died routinely. And so what are we really doing as far as the maternal events and deaths that are occurring in the hospital institutions? Some doctors are still on staff. Have they been reviewed? Have they been course corrected? And so that I believe that's where we are missing the mark, because again, earlier I said there's an abundance of data, of all levels that are pointing to racism, and how are we really applying it? As somebody who is Black, I'm not a mama yet, but I am Black, and again, I seek out Black providers as well. I do my research. I am on the Googles, okay? But I just, it's just sort of how are we really embracing the real fear of going into these institutions and feeling like we're just not heard, we're not, human.
I want to imagine a future where giving birth in a hospital, in particular here in New York City, is an option. And it's an option that comes with others, right? So we have an option to go to a hospital. We have an option to go to a freestanding birthing center, where we do not really have the option here in New York. And we have an option to birth at home. And those three options are presented as solid, evidence-based, and they are supported by all of the people who need to be who provide the support across the board. So we know right now that in the hospital, majority of people give birth in the hospital, and that's where we're seeing really bad outcomes, right? So why not invest in better options for more people? I told a story earlier about giving birth with a Black midwife twice here in New York City. I gave birth at home, not because that was what I sought out initially. It was because I was insulted by a doctor in a hospital. I didn't have very strong options for birthing in a birthing center, and the best person who I interviewed to support me was a home birth midwife. So we need more of that. We need to build that out, and it's going to take a lot to make that happen.
The Maternal Mortality Review Committee comes up with very robust recommendations when these unfortunate maternal deaths are reviewed. One of the main recommendations that keeps reoccurring, that has reoccurred over the years, actually is having a maternal medical home. This is an evidence-based strategy because two of the reasons that maternal deaths happen are lack of clinical care coordination and also lack of clinical skill. People weren't referred. People were held on to and not referred to where they needed to be to get the care that they need. There also needs to be robust workforce development. Two of the main players that need to be robustly developed are midwives and also psychiatric providers who can prescribe. Because if we're seeing these numbers in overdose and suicide, then people who have substance use and misuse, we heard earlier there's only 2 centers in all of New York City that treat pregnant women with substance use, but we're having all of these deaths. And we also need to deeply understand, while we're calling this maternal mental health, it's really not that. We really need to be correcting ourselves. It's untreated mental health that has gone on forever, since before the person was even pregnant, and now we're paying attention to it because the person had a baby and died. Okay, these people by and large have high ACE scores, have high social determinants of health that are not addressed, and pregnancy just go ahead and cascades them out of control because they're not getting the coordinated services they need. So in my world, there would be more clinicians that actually treat the shortages of the things that women and birthing people need most, and that really cater to their need to return birth to safety, satisfaction, and sacredness.
I think for me it is a celebration of Black motherhood. That's my vision, and that's what I think is absolutely needed. There's so many times that Black motherhood in the media, everywhere, just how it showed how people see it. It's so negative. I really think a celebration of Black motherhood and recognizing us for who we are and what we do, that's my vision. If we could start celebrating Black motherhood just a little bit more, and I guess bringing back the joy, right?
What I want to say to leave you is, let us not cease having infinite hope, and let's return joy to the birthing experience for our birthing people. Thank you. Oh, we have a question.